on the second lecture piece of the appendicular skeleton lecture, and we've already talked about the pectoral girdle, which includes the scapula and the clavicles. And so now we're going to be moving on to the arm. And for the arm, what bone sits in this glenoid cavity? That would be the humerus. Okay, so this creates what's called the glenohumeral joint. Gleno as in glenoid cavity, humeral as in humerus. Now, on the humerus has a large, bulbous, round projection that is going to be called a head. And you've seen heads before, and you'll see them again. So, for example, right here on the femur, this is also a head. Okay, so we have a large, bulbous, round projection. That is going to be a head. Okay, so the head of the humerus is going to sit into the glenoid cavity, and this creates what's called a ball and socket joint, and it allows for quite a lot of movement. So your shoulder is the most movable joint on your body. Okay, so there is the glenohumeral joint, which is basically your shoulder joint there. The glenoid cavity here on the scapula and the head of the humerus there. Okay, so looking at the humerus here, you have the head on the proximal end, so the end that is going to be connected to the scapula there. Just outside or just lateral to the head, you have two medium-sized bumps. Okay, so on the smaller side, so they're not super big, but they're definitely rough bumps, rough rounded bumps. Those are going to be for muscle attachments. We have the two tubercles. The big one is called the greater tubercle, and the greater tubercle kind of wraps around to the posterior side. So here is the greater tubercle here. Greater tubercle there. So if we have the greater tubercle, the slightly smaller one more anteriorly, what is that one you think? That is the lesser tubercle. So generally, if you have a greater, you're going to have a lesser. They come in pairs. That's what they're called for. And the groove running in between the greater and lesser tubercle is called the intertubercular groove. Okay, so it's the groove between, so inter means between the tubercles. Intertubercular groove, that's this one running right down between the two tubercles. Okay, that'll be on the proximal end there. And then looking at the distal end, you're going to see two distinctive articulation points. So they're going to be smooth because they're going to come in contact with other bumps. Okay, so you have one that is very round. That is called the capitulum. Okay, so the one that's super round, that is going to be called the capitulum. And then the one that's next to it, that is going to be called the trochlea. Now the trochlea to me looks a lot like a spool. Right, so we've got the spool like you wrap thread around. That is the trochlea and the capitulum. Okay, so the trochlea will be the medial one, the capitulum will be the lateral one. And then above the trochlea, you have a fossa. A fossa is a depression. That's called the coronoid fossa for reasons that I will get into. So that would be this depression right here. And then on the back, on the posterior side, you have a much, much more pronounced, much deeper fossa. That's going to be called the olecranon fossa, and that will be on the back. Okay, so if we're going to be sighting our bone here, the first question we want to ask ourselves is if we're looking at a picture, are we looking at the front of the bone or the back of the bone? Okay, so to answer that question, I prefer to look down here on the, oops, wrong direction, on the distal end of the humerus. Okay, so what was really different on that distal end? To me, it was this super big fossa here. And that super big fossa comes from the fact that this right here, this is called the ulna. The ulna has a very distinctive kind of U-shaped structure here. So U is for ulna. I think of it sort of like a monkey hand. But on the end of here, this right here, this is called the olecranon. And the olecranon is actually the tip of your elbow. Okay, so when you feel the very tip of your elbow, that's your olecranon process. Okay, so the olecranon, what it does is the ulna is going to rotate around the trochlea. This is the trochlea here. So here's your trochlea there, and there's the ulna right there. So the olecranon would be the tip of it right there. There's the olecranon there. There's the olecranon there. And that is going to rotate around the trochlea. Okay, so when your arm is straight, you need some place for it to go. Okay, some place for the olecranon to enter. Okay, so if you have your arm bent like this, okay, there's the point of your elbow right there, your olecranon. When you straighten it, it has to have some place to go. And where does it go? It goes into the olecranon fossa. Now your elbow is on the back of your arm, right? Not the front, okay? So that helps me remember that the olecranon fossa, the deep depression there, that is going to be on the posterior, the back side of the humerus. Okay, so if you see a big deep depression, that's on the back. Whereas the capitulum and the trochlea, even though they do wrap around to the back a little bit, they're mostly on the front. Okay, so you have the capitulum and the trochlea on the front and the olecranon on the back. Okay, so when you're looking at the humerus, the deep depression is called the olecranon fossa. That is going to be on the posterior side of the humerus. Now, if you look on the anterior side, you also have a little depression, and that also comes from its articulation with the ulna. Okay, so this right here, this is the olecranon, the big point right there. But again, it looks sort of like a monkey hand, right? So these fingers up here would be the olecranon, but there's a thumb there too, this part right here. So this right here, this is called the coronoid process. There's an in there. So it's not the same as coracoid process, which was found on the scapula. So this was the coracoid process. Now we have a new one that is the coronoid process with an N. But this right here, when you think about that hinge joint that's created between the articulation of the ulna and the trochlea, when it's straight, the olecranon is going to be in the olecranon fossa. But when your elbow is bent, you also need a place for the coronoid process to go. So the coronoid process is going to go into the coronoid fossa on the anterior side of the humerus. Okay, so this little coronoid process is going to go into the coronoid fossa, which is seen only on the anterior side of the humerus. Okay, so one thing I'd like you to notice is, please note that the ulna is going to articulate with the trochlea. What is going to articulate with the capitulum? This one here. This is called the radius. Okay, so the radius, which is this one here, that is going to be the lateral bone. That'll be on the thumb side. So the radius will be on the thumb side, the lateral side. That is going to articulate with the capitulum, the round bulbous one there. Capitulum, like capital, like head, makes a bulbous. And that, see how this on the radius, this thing that looks a lot like a golf tee, this is called the head of the radius, and the head of the radius has a little divot in the top of it. And the divot in the top of it allows for some rotation around the capitulum. Okay, so your ulna allows your arm to bend like a hinge joint, like this, as the olecranon rotates around the trochlea, whereas the radius allows your arm to move like this, because the radius, the head of the radius here, and that little divot point is going to allow for some rotation, some pivot around the capitulum. Okay, so that's going to create some very specialized action words that we'll talk more about later when we get to the joint. Okay, so let's see. So if we're trying, let's go back to siding it. If we're trying to side the humerus here, the first question we need to ask ourselves is anterior versus posterior. What are you going to look at? For me, I look at whether or not you see that deep depression, which is the olecranon fossa there. That tells me that this is the back side, okay? And then the second thing you need to look at is that head, right? So we need to figure out anterior versus posterior, then medial versus lateral. This is the head of the humerus. If this is the head, is this the medial side or the lateral side? This has to be the medial side. And that's important because the medial side here is going to connect onto the body. It makes no sense for it to go like this because you wouldn't have that connection point. So if this is the medial side, so I know I'm on the front, I see the trochlea and the capitulum, I do not see the olecranon fossa. I do see the head of the humerus there. Okay, so this bone right here, is it a left or right? This one right here, and the one I'm holding, is a right bone. Okay, so it's going to take some practice and you have to go through a lot in order to get there. Okay, so let's move on a little bit more to these. Okay, so remember, if it has the golf tee, it is the radius. And again, that's not the official term for it. That's just what it looks like to me. Okay, this is actually called the head of the radius. Underneath the head of the radius, you have a kind of large, but not super big, but fairly large rough bump. That's going to be for muscle attachments. What is this? Okay, so that's a tuberosity, and the tuberosity is going to be on the radius. So that is called the radial tuberosity. Okay, so the head of the humerus, this, and the radial tuberosity is this rather large, pretty distinctive rough bump on the radius. Okay, now looking at the bottom here, in the head, and hopefully you are pretty good with the skull by now, right next to the mastoid process is a very sharp process that sticks out, very sharp process that sticks straight out. That was called the styloid process. So here on the radius, this part that's sharper that sticks out, that is called the styloid process. Okay, so there's the styloid process on the radius, and then the ulna also has a styloid process on the distal end as well. Okay, so the styloid process of the radius here and the styloid process of the ulna there. Okay, so the radius looks like a golf tee, and the ulna, to me, you can either think like U is for ulna, or you can think like the monkey hand is for the ulna, whatever works for you. And looking at this here, remember that if you're thinking of it like a monkey hand, that's how I think of it. This part right here is the olecranon. The thumb part, which would be this part there, would be the coronoid process. And again, it's an N, not coracoid. That's on the scapula. So here's the coronoid process. And then this articulation point, so the inside part right here, the one that makes that U, what is that articulate with? What bone feature does it move around? Okay, that's going to move around and articulate with the trochlea. So this is going to be the trochlear notch. And the notch just is a word for a cutout, right? Like a little like a cut it out. So here is the trochlear notch. Here is the olecranon. So trochlear notch, olecranon, and then coronoid process. All of this would be on the proximal end of the ulna. On the distal end of the ulna, you're going to see that styloid process there. Again, that's a sharp projection coming off of it. Okay, let's see. Did I cut everything? I think I did. Okay, so last thing I wanted to really hit is please remember that the radius is on the lateral side. Radius is the lateral side, the thumb side, and the ulna is on the medial side, the pinky side, if you're looking at anatomical position, which we always are. Okay, so medial, lateral. Okay. So I think I covered all of those pieces. Okay, so let's go over a couple of things for bone attachments. We did mention some of them already. Well, for example, this is the radial tuberosity, and it's rough like that because it attaches some muscles. Let's go back to the humerus, and if we look at the humerus, if we're looking at the anterior side of the humerus, if you look on the lateral side of the humerus, you know, further away, the same side that you would see the tubercles, the greater tubercle especially, you're going to see a little rough bump, and it's kind of, it sticks out quite a lot, but it's much more subtle, right? It's more like a general sloping, and that is going to be the deltoid tuberosity. Why do you think it's called the deltoid tuberosity? Because that is the insertion point for the deltoid, which is a triangular shaped muscle on your shoulder that's going to abduct your arm. Okay, so that's going to be on the lateral side of the humerus. Let's see, yeah, right here. So lateral side of the humerus, this gentle sloping, but you know, fairly large if you look at it as a whole, that's the deltoid tuberosity. Deltoid tuberosity on the lateral side, on the same side as the greater tubercle. Okay, so another thing, kind of pair of rough bumps are the epicondyles. Now, a condyle means a smooth bump for articulations, for bone-to-bone contact. They kind of wore each other smooth. Okay, that's how I think of it at least. But on the outside of the humerus, on the medial and the lateral side, we have epicondyles. And epicondyles are different from condyles because they're going to be rough, because they're for muscle attachments, not for articulations, not bone-to-bone contact. Okay, so they're going to have a different textures. So the key to learning the epicondyles of the humerus is to make sure you're really, really clear on what side is medial and what side is lateral. So if I just like showed you a bit, you know, a close-up of it, it would be kind of a little bit trickier to figure it out. But if I kind of backed up and I showed you the whole bone, remember that the head is medial, right? The head has to be medial because that's what's connecting it onto your body. So if the head is medial, this rough bump on the medial side, that is going to be the medial epicondyle. Okay, so here is the medial, sorry, I'm looking for a picture. Here is the medial epicondyle, and the medial epicondyle is bigger than the lateral epicondyle. That's one thing you can look at. Okay, so here's the capitulum, the trochlea, the rough bump here, that's the medial epicondyle. You can look in this picture, there's the medial epicondyle. And then on the other side, that would be the lateral epicondyle. Okay, and to give you a preview for muscles, again, these are for muscle attachments. The lateral epicondyle would be the attachments for the extensors, the ones that extend your wrist. And so extend your wrist there. And then the medial epicondyle, those would be the attachments for your wrist flexors. You can even feel like where you can feel, if you move it around, you can feel where they attach. That'll be the medial side and the lateral side. The other thing I wanted to point out is notice how that medial epicondyle sticks out quite a bit, and you can find it on yourself if you follow your humerus down, that kind of knobby part on the medial side. So not your point of your elbow, that's the olecranon of the ulna, but more proximal to that and more sort of sticking out more on the side of it, that would be the medial epicondyle. And so when you hit your funny bone, that's what you're hitting, because the ulnar nerve runs right along that, and it's going to zing you and it hurts. Okay, so that's the medial epicondyle there. Okay, went through all that. Okay, I'm going to go ahead and stop it, and I'll do a separate one for the carpals, metacarpals, and phalanges.